My name is Emmy Shawver, and this is my informative speech. According to the Breast Cancer Research Foundation's website, 1 in 8 women will get breast cancer. Most people have had an experience with some sort of disease, whether you had one personally, someone you loved had one, or someone that you just know had one. My grandma had breast cancer and passed away 5 years ago. I've always been interested in researching breast cancer as much as I can because of my grandma. Today, I would like to share with you what I've learned through my research of breast cancer, about what breast cancer is, the stages of breast cancer, and the treatments you can try. People might think it is a little ridiculous to go over what breast cancer really is because obviously it is cancer that starts in someone's breasts. But usually that is as much as anyone knows. According to the National Breast Cancer Foundation, cancer is when abnormal cells grow and invade healthy cells of the body. So breast cancer is when these abnormal cells invade the cells of the breast that can invade surrounding tissues and spread to other parts of the body. Cancer can develop when the growth process goes wrong and new cells are made when the body doesn't need them, or when old or damaged cells don't die like they should. This forms a tissue mass that is called a growth or a tumor. The body's hormones and chemicals might also accelerate the growth rate of some of these tumors. The cancer cells can also travel to other parts of the body by blood vessels and lymph nodes. Now, there are different stages of breast cancer. The stages are from 0 to 4, so there are 5 stages. Early detection is very important for breast cancer. Women should be doing self-exams at least once a month, routinely. Some symptoms that you might notice are tenderness, a lump, change in skin texture, a change in the size or shape, any dimpling, swelling, shrinking, or if the skin becomes scaly and red. These are only some of the symptoms that you might have. The stages indicate the size of the tumor and whether or not the cancer cells are contained to their origin. Stage 0 is usually not considered cancer, but it indicates that a person has an increased risk of developing breast cancer. Stage 1 is cancer that is contained to where the abnormal cells first begin to grow. The stage 1 breast cancer can be very effectively treated. Stage 2, the tumor is still only in the breast, but it has spread to the lymph nodes. Usually stage 2 breast cancer responds well to treatment. Stage 3 means that the breast cancer has spread to the lymph nodes and the muscles. At stage 3, breast cancer is still often treatable. Although patients most likely undergo 2 or more treatments for breast cancer that is in stage 3. Stage 4 breast cancer means it is spread to other areas of the body, and it is the highest stage that breast cancer gets to. And it spreads to places like the brain, the bones, lungs, and the liver. Unfortunately, stage 4 breast cancer is considered incurable. But there are treatment options that the cancer responds to that can extend someone's life for several more years. Once you are diagnosed for breast cancer, there are different options for you to try. Some of the main treatments include surgery, radiation, and chemotherapy. Surgery is the most common form of treatment for breast cancer. The tumor in the margins, which is the surrounding tissue of that abnormal cells could have traveled to, are removed. With more advanced stages, there might be a different method used first to shrink the tumor, and then they will use surgery to remove it. The next method uses high-energy rays to kill the cancer cells. It's called radiation therapy. To reduce the risk of cancer reoccurring and to destroy undetected cancer cells, they will use radiation. Radiation is also used to shrink tumors. And these are radiation machines. The last treatment that most people hear about is chemotherapy. This treatment uses a combination of drugs to destroy the cancer cells or to slow down their growth. Usually other treatments are suggested along with chemo, like hormonal and targeted therapies. Chemo, like radiation, is It's also used to shrink tumors before the surgery. When receiving chemotherapy, it is administered to you in short periods with many weeks in between for your normal cells to have a chance to recover. During this treatment, it is very emotionally and physically challenging. And these are two women getting chemotherapy. Being well informed on a topic that is likely to be a part of all of our lives at some point is a very important thing. If you are never touched by breast cancer or cancer, then consider yourself lucky. It is a hard thing no matter where you stand and what position you are put in. Knowing what breast cancer is, what to look for, what stages there are, and what types of treatments are out there makes you that much more prepared. It is always better to be prepared for things. You never know when you might find out that you or someone that you love has cancer. Hopefully, you don't have to go through anything like that, but being well aware of these things can certainly help.